Hello, everybody. Welcome. So we're all sitting. I thought I would stand, but Mike asked to chat, as he said. Okay, I need to hold it closer. Thank you. Because it's pretty loud here. Thank you all for being here in this very informal setting. It's actually what I hoped it would be. I would like to introduce Mike and say that we have a very free format, but there are a couple of things that we will do first. So first, Mike will answer 3 questions. So this is literally why he wrote this book, how it was at the time, and what we can learn from it, basically. So he will talk about that a bit. After that, there's time for discussion and questions. And also we will end with Mike reading a little bit of the role you played, according to Mike, of course, in his book. So first, Mike, I'm just very happy that you're here. As the team knows, I felt responsible for everything during IAC, but I kept on nagging that we had to do this in the right way. I very much respect you. I'm also thankful very much, as you know. And this goes back to a very long time ago. So you worked for Mike, was hired by Mike. And Mike, you said basically, go to Uganda. You ordered him to go to Uganda. And I explicitly heard from Joep that it was orders at that time. It was stating. And that changed his life. And the consequences is that I think we are all working for this group, or sorry, a lot of people here are working for this group. And that has really goes back to 92. It changed his life, seeing the situation in Uganda. And from that time on, Joep wanted to do work on getting treatment to Africa. Started Farm Access and later started AIGHD. You've also sent me a very personal letter from 94 when Joep left WHO, thanking you basically. And what I find remarkable, and I'm not going to quote from that letter, but what I find remarkable is that 20 years later, so in 13, when we started working on what is now ATI, he basically, you can copy it. He has still completely the same observations and the same, how he talked about you was completely the same. And I take that very seriously. So Mike, I'm very happy that you're here. At that time, you don't know, you were also always saying as a sort of sideline, yeah, by the way, I'm in the last part of my career, although I just heard that you're going to start a new Global Health Institute in Singapore and that you travel there tomorrow. So I'm not sure about it, what's really the end of your career. But you said, yeah, I'm writing a book. And it happened in 2013, and then I heard it in 14, I heard it in 15, and I thought, oh, I'm not sure, maybe it's not going that well with the book. But now that I saw the book, it's not your book, it's your work, it's your life work, basically. And I'm really happy that you will talk about it. I think we can learn a lot from it. And please, take off.
Okay. Thank you. Well, Mikkel, thank you. It's wonderful to be here. A little emotional, actually. I presented the book in other settings. Normally, it's a bigger setting and not so personal, but it's special. This is very special to be here. And Mikkel said, let's not make this just about Joep. But I will a little bit talk about Joep in my end of my presentation. So the title of the book, and there are copies here if anybody wants one, at the end. Mikkel very graciously bought copies for anyone who came here, and I'm very grateful for that. I should thank you for organizing this, and for you patients as well. I'm sorry my co-author isn't here, Stephen Inrig. It is co-authored. I'll say more about that in a second. We usually do these presentations together, and you'll hear why in a second. So in introducing the book, as Mikhail said, I'm going to answer 3 questions. There's no way you can present a 400, 500-page book adequately. So let me just answer 3 questions, which will make you understand what the book's about. So the first question is, why write this book? It's quite a title. The AIDS Pandemic, Searching for a Global Response, which means we are still searching. But it's what the book is about, how we have been searching for a global response. So you all know, of course, that the pandemic is the worst in modern history. And that more recently, of course, treatment has had a huge impact. But it's been quite a struggle. And it's 37 years a struggle. Okay? We forget sometimes. And what this book we wanted to tell was the story of how governments, UN agencies, civil society, the private sector, HIV-infected people, how have we responded over the course of these it was actually 36 years when we wrote the book. Now, a big part of the book, the first part of the book, not surprisingly, focuses on the WHO Global Program on AIDS, which led the response beginning in 1987. Just take yourself back. Many of you were not even born, or you certainly never heard of AIDS, in 1987. Now, this is 6 years after the first AIDS case was diagnosed. 81's your first case. 87, the program starts. A decade, and this is important, before the discovery of HAART, and at a time when it was obviously a fatal disease, and the course of the pandemic was not known where we would be. The program started in 87. In 1995, the program is shut down. Shut down. The program that is leading the global response. We now know that that was at the peak of HIV infections. Why was it shut down? The performance of the Director General, the performance of the program, and feuding between UN agencies. I'm going to say a little more about that. I directed the program between 90 and 95. I succeeded Jonathan Mann, who started the program in 87 and resigned precipitously in March of 1990. I'll say more about that in a second. He was a true AIDS hero. You have a memorial lecture in his name. Ironically, like Joep, he died in a Swiss Air crash over Newfoundland in 1998. Some of you may know the story of how that plane went down. It was not shot down, it was an accident. It was a fire in the system that controlled the movies and games. I replaced a hero in taking over that program. One of the big reasons for writing the book is I wanted to tell the story of how nearly 500 staff in the global program worked tirelessly and passionately to confront the pandemic at that time that I just described to you, which I feel in many ways was the most difficult time in the pandemic. Many people at this conference have never heard of the global program on AIDS, certainly not aware of what we faced and what we achieved at a very tough time. Nor are they aware how what happened way back then we are still living with today. Now, the book also covers the period from when the first case was discovered to when the program started, when WHO's response, if I'm polite, I would say cautious. If I'm honest, I would say completely feeble. It also covers the book. In the book, we talk about the creation of UNAIDS, all of the challenges and obstacles it faced as it replaced the WHO program. And then the final section of the book brings you up to date on what happened since the turn of the century. And we finish with some lessons learned. How do we put it together? It was a long process, as you heard. It took me over 10 years. Let me tell you what I did. We had to go back and review all of the files from the program that I ran. They were all in the basement of the World Health Organization, paper files. We spent a lot of time reviewing those. We conducted over 125 interviews and transcribed them, who were key players in the epidemic from then to now. We drew upon 1,300 source materials, including newspapers, historical documents, books, and memoirs. And we had 5 outstanding reviewers who we pushed hard to tell us how we could do a better book. We had a small grant, to be completely transparent here, from the Kaiser Family Foundation to help us with this exhaustive process. Now, let me say this is not a conventional history for 2 reasons. One, AIDS isn't over yet. This is not like writing the history of the Civil War in the United States, or World War I or World War II. And secondly, I was a participant observer. I know that. I ran the global program on AIDS for 5 years during this 36-year period. And that's why I invited Steven Inrig to be my co-author. Steve is a historian. He has nothing vested except the truth as a historian. And he sure kept me honest as I recalled many things that happened during that period. And I think the book is about as accurate, as unbiased as it can be, but I have to confess, I was a participant observer in the book. So that's why we wrote the book. So, what was it like, second question, what was it like in 1987? What was it like to have to set up a program dealing with this pandemic? So what did we face? Very quickly, I'm going to just quickly tell you. We knew that first the disease itself was complicated because there was a 10-year history between infection and disease. So when the first cases emerged in 1981, and then we didn't start till 87, think about that. We had no idea how much this pandemic had spread because HIV at the time, you didn't know there was no test. So we didn't know how bad this was. So basically we had to play catch up from the beginning. So we started really dealing with this 5 years after the first case is discovered in Los Angeles by a dermatologist. 5 cases of Kaposi sarcoma. Second, the huge stigma, discrimination, and denial, which really was due to the things as it is today, modes of transmission, the disfiguration that it caused, wasting syndrome and Kaposi sarcoma, and the fact that it was fatal, and the fact that it was transmitted by very personal behaviors. So we faced a delay. We had no idea what we were dealing with in severity. We were faced with stigma, discrimination, and denial. And then, as I mentioned, number 3, WHO, for 5 years, did nothing. The Director General, who passed away recently, Haften Mahler, and I talked about this very frankly. And he told me we were reluctant. WHO was reluctant. I was reluctant for WHO to take on a social disease. That was his term, a social disease. We thought this was a rich country disease. They could take care of it. He only changed in 1986 at a critical moment in the World Health Assembly when the Minister of Health of Uganda stood up. You could hear a pin drop in front of thousands of people and said, "We have AIDS, we are scared, people are starting to die, come help us." This was a momentous moment when the government of Uganda stood up and admitted it had the disease and really had the disease. Please, they begged for help. And after that, if you read the transcript, African country after African country stands up and says, "We have it too." So whatever you think of Museveni, you should know that his government was the one that broke the silence. So we dealt finally, it took a long time for it to be admitted and to respond. Then we had battles on the conflicting ways to handle the pandemic. Was this a public health biomedical problem? Was it a development vulnerability problem? Was it a human rights problem? We were accused in WHO of following a medical model. This was worse after John Mann resigned. He was a human rights advocate, and we could never shake off the distrust of some of the donors that we were simply following a medical model. Sort of ironic when drugs were going to eventually make this really a medical model. Then we had fierce battles, I already mentioned, between UN agencies. And part of it was related to the way you looked at the disease. UNDP in particular and really felt this was a disease of vulnerability. In any event, the donors became very frustrated by the fact that the UN agencies could not get their act together. And there were also some personal animosities that had built up between the leaders of some of the UN agencies. It's all described in the book. Two more issues we faced. One was WHO as an agency, and I'm very frank here, but the structure and operational capabilities of WHO to lead a pandemic was greatly challenged. What Houghton Mahler did was he said, I know that our agency is not good at running things in the field, like UNICEF, and I'm going to have the program report to me directly, not to the regional directors. Like, that's the way smallpox was eradicated. Okay? When Mahler decided not to continue in 1988, Nakajima took over. Dr. Nakajima became Director General, and he wanted the program. He was a very traditionalist. He came out of the Western Pacific region as regional director, and he wanted the program to be back into WHO's operations. When that happened, the donor community felt great reluctance to continue to trust WHO. We tried our best to satisfy them, but we couldn't. And then the seventh challenge that we faced was Dr. Nakajima was accused during his first term of a lot of corruption, and there were concerns about his performance. Some of it not very fair, but he was reelected in 1992 in a very controversial election. And following that, the donors more or less felt we had to pull out of WHO as the leader in the epidemic. So let me go over those very, very quickly with you, what we faced. We faced the disease itself. We had no idea how bad it was. We felt stigma discrimination. We faced stigma discrimination and denial. We had WHO initially being very reluctant to confront the pandemic. Once we got in, others had different views on how it should be confronted. This led to competition for resources. And then there started to be doubts about WHO's operational competence because of a change in Director General, and then his performance itself even added to those doubts. Unfortunately, some of these obstacles and challenges we still face. The disease is still concealed. We still have stigma, discrimination, and denial. We still have conflicting views on how to handle the pandemic. And we sure have competition for resources and questions about some of the leadership among some of the main actors. This all sound familiar, I'm sure. So let me say before I move on from this that GPA did wonderful things. That isn't known, and I describe these in the book in all fairness to these 500 people, including Joep, who worked so hard during this period. We took on prevention. The word safe sex never existed until WHO invented it. Harm reduction policies. We were very frank about prevention. Nothing held us back. We had no inhibitions. We supported 120 countries who needed support to get their programs off the ground. Some say that was our greatest achievement. 500 people, 300 in the field, working day and night in these 120 countries. We developed a comprehensive approach to care and support without ARVs. Joep and others started interacting with pharma, particularly Burroughs Wellcome, who had AZT. And I describe in the book an amazing story when I went off into the mountains in Germany to talk to, they wouldn't talk to me at the conference in Berlin. we created, for the first time, strong partnerships with civil society who became part of our management and who received direct support. GMP Plus, for example, we helped to create, and other organizations, and ICASO was mostly supported through WHO. And we had a very large research agenda on vaccine and drug development, diagnostics, and epidemiological and social behavioral research. So how did the program close? There was actually a secret meeting, which I knew nothing about, that all of our donors convened quietly in London, chaired by David Nabarro, who is now in WHO. He at the time was working for the British government. And they decided that that was it, and we were going to change course. And they passed a resolution in the World Health Assembly a month later, calling for a study of a new mechanism to take on the AIDS pandemic that was going to involve a co-sponsored program and would replace the WHO program. And to make a long story short, when ECOSOC endorsed this program, that's the Economic and Social Council of the UN, in July of '94, that was it. GPA was asked to close its doors on December 31st, 2005, and UNAIDS was to open its doors the next day. You can be sure these were chaotic times, and as I told you, we now know this is absolutely when there was a peak in HIV infections. 1996 is the peak of HIV infections, and we are closing down the program that's leading the response. You can imagine how chaotic it was. 500 people losing their jobs within a year, but I will tell you, they worked day and night until their jobs ended. Many got jobs, some didn't, and there was a massive lawsuit taken out by those that didn't get jobs. WHO had to hold back $20 million because of this lawsuit that these staff members took out on WHO. Very sad. Neither WHO nor the global program handled it well. UNAIDS had to create a mandate for itself in a year. And there were fights going on whether UNAIDS should be controlled by ECOSOC in New York or by the UN in Geneva. You must remember that after the Cold War, those of you who know the Cold War history, after the Cold War and the Berlin Wall fell, there was hope in the UN that you would have UN reform and a much stronger UN. And the head of ECOSOC at the time was Richard Butler. Some of you know his name from Australia. He actually was involved in the Iraq War when he was certifying whether there was nuclear weapons. But at the end of the Cold War, New York really wanted to take over and did not like any power left in Geneva. But in the end, UNAIDS was set up on the WHO campus, unfortunately. Then there was a big fight about who would run UNAIDS. I can tell you, many different governments wanted to have the leadership. Peter Piot's selection by the Secretary General was very controversial. A very good choice, but a very controversial one. Then once UNAIDS got up and running, there was tension between the 6 co-sponsoring UN agencies that were supposedly going to help UNAIDS get off the ground. Remember, we're moving from a WHO-led program to a joint and co-sponsored program of the UN agencies. It got so bad that the WHO regional directors actually expressed openly that they wanted UNAIDS to fail. UNDP refused to shut down its own program for 2 years. And the head of the UNDP program and the head of UNAIDS were at war for 2 years. It's all documented in the book. So you can imagine the way UNAIDS had to get off the ground with the UN agencies. And to make things worse, the behavior of the donors was shameful. So they decided that UNAIDS really didn't need that much money, and they actually gave 50% of the amount that they had given to WHO's program to UNAIDS, and they also didn't force the co-sponsors to be accountable for their commitments. Instead, what we saw was a large increase in bilateral programs. that replaced the money that had been used. WHO had showed them how to handle AIDS, and they were much more comfortable with bilateral programs than they were when the pandemic started. And then, of course, there's the countries. So I told you that 120 countries were receiving WHO support. When UNAIDS was created, the idea was that the countries would not need any more support from the UN agencies. So there was no money to start with in the UNAIDS budget for country support. So these 120 countries lost overnight the support they were getting from the UN family. I can't prove it to you, but as we talk about in the book, there were many deaths that occurred because of this. Now, eventually, UNAIDS found its place in the global response with the discovery of ARVs. It really was groundbreaking in the way they dropped the prices. They took the lead in collection and provision of real data on the state of the pandemic. And if you read Peter Piat's book, No Time to Lose, he describes this very well. And then, as you all know, this was followed by PEPFAR and the Global Fund in 2002 and 2003. That's its own story. And UNAIDS had to then adapt to the creation of PEPFAR and the Global Fund, but I will save that for another day. But that itself brings us to my third and last point, which is, what do we take away from this? And what does it mean now? So the book goes into a number of takeaways. I'll just mention three here. I'm just going to mention three takeaways here, and then I'll say a little bit of what I think are the real challenges. So, the three takeaways are: mounting a global response to a pandemic, especially against a new and fatal disease, is a complex process. It's quite an effort to develop strategies, recruit staff, raise resources, maintain momentum in the face of numerous challenges and media scrutiny. Shutting down a program, no matter its perceived shortcomings, really needs to be done carefully and thinking about the consequences. Donor countries in particular should not be impulsive or impatient and should resist shifting strategies to pursue short-term solutions for complex problems. So there's a real lesson in here for donors about how to think about the UN family and how to cope with pandemics. Secondly, there's the issue of accountability. If you look at this story, as I describe in the book, there's real issues of accountability with the donor countries and with the international organizations. The failure of the UN organizations to live up to what they promised to work together in UNAIDS. I sat with the heads of the 6 UN agencies in the office of Bujoskali, just the 6 UN agency heads and myself, and each one of those agency heads pledged they would do all they could do to confront the AIDS pandemic in 1994. But when UNAIDS was created, they all forgot how much they had been committed. And then third, I think we learned from this story that there's rarely a simple magic bullet for dealing with pandemics. There can be, but it's unlikely. Science is complex, scalability is difficult, and one size doesn't usually fit all. Diseases like AIDS reveal a great deal about social structural inequalities across societies. Prevention, we have to remember, is a slow process, particularly when you have a disease like AIDS that's evoking panic and discrimination. And the battles that we went through is whether AIDS was a public health problem, human rights problem, or development problem, they should never happen again. All three of these sectors, all three of these approaches need to come together. And finally, that leads to the question of what about today? So where I see us today, we haven't had a new agency since the Global Fund. And I think what happened following that was we've had about 10 years of being a little more relaxed because we had treatment. And so the period I'm talked about up till now has been a period of very little treatment, people dying, mostly focused on prevention. And we went through a period of 10 years of treatment. And what I've heard over and over again in this conference and the new data from the UNAIDS report, although it's not a surprise, is just like we knew it, we can't treat ourselves out of this pandemic. And so what you hear here, and I've been in some very high-level sessions, is there's discussions going on that went on in the 90s before we had drugs. What are we going to do now that we see that drugs aren't the whole answer? I ran this international conference from 90 to 95. I am so struck at this conference how few heads of governments are here, how few ministers are here. We've really become a little complacent. This is not a statement of the performance of UNAIDS or the Global Fund or PEPFAR. These are the three major players now. It's the fact that we have stopped being as concerned about the pandemic as we should be. And the strong advocacy and the global commitment that we had back in the 90s, we need it back. And we need to think about how we're going to cope with our current situation. What is the solution? I saw some data this week of 70%, 70, prevalence in HIV, prevalence in women in KwaZulu-Natal. It's frightening to see that data. 70. When I ran the global program, we saw 40 and 50% in many, many countries. I don't know that we ever saw 70% in any high-risk population, what you call key population. Young people in particular need to understand what AIDS was like when it was a fatal disease. Secondly, we now have a rather ironic return to the past with universal health care, UHC, the mantra now of WHO. So many of you may know that in 1986, right before I joined WHO, there was the Alma Ata conference, and primary health care was discovered. Well, that lasted only 2 years. I said 1976. When Hofton Mahler said to me, I can't raise a dime for universal health care. Instead, we're going to have a child survival revolution because that's how we're going to move health systems. People feel that just trying to raise money for health systems is a bottomless pit. Well, I think we've come a long way in understanding that we really do need to strengthen our health systems. But my fear now, not only do we have complacency, but there are people that see UHC as the end of an AIDS response. We'll just bring AIDS into the UHC response. And that, I predict, will be very unfortunate. Because I don't know many health systems that are going to really take care of key populations, that are going to welcome civil society into the management of their health systems. So I think we do need to integrate much more, as you'll hear tomorrow when the Lancet Commission report comes out. We do need to merge our thinking about universal health care with AIDS, but we need to do it carefully, and we need to remember to never leave anyone behind, or our complacency will be compounded by giving up our exceptionalism. This is not a time to give up completely AIDS exceptionalism. And those involved in creating health systems and working hard, as you're doing in Farm Access, to really work hard to create universal health care, need to see the lessons that were learned from AIDS and bring them in and work together and learn from each other. And then lastly, and this I think is from the global level the most interesting challenge, and that's that financial resources, as you all know, for AIDS are not what they were. There's only one bilateral left in AIDS, and that's the U.S. government. And I needn't tell this audience how precarious this is. We live in a very precarious time where democracy is threatened and our whole liberal order that we've lived with for decades is falling apart, not just in the U.S. And the rise of populism, therefore, is not helping us. But I would appeal for those leading the global response now to have the courage to sit down and say, okay, here's where we are today. Here's what we've learned. What is the new paradigm? How are we going to work together? Should we bring WHO back in a much more forceful way? Before it's pushed to UHC, it becomes almost anti-AIDS. Can the Global Fund and PEPFAR and UNAIDS create a real, true partnership? Do we even need all three of them anymore? I mean, I think those questions really should be asked. So those are my three challenges, and I'll just make one more comment, and then I want to read one paragraph. There was a review done of the book. This book was reviewed very interestingly by Richard Horton in The Lancet. And it's a very interesting review. He was very kind. He said the book should be on the bedside table of every prime minister. It was a very nice comment. But more importantly, he made the point that I didn't think about enough in writing the book. And his point was, we forget, all of us, how much personalities matter. And sometimes, despite the best laid plans, programs and agencies are run by people. And people can be noble, they can be selfless, and they can be humanitarian, but they can be flawed, they can be stubborn, and they can be territorial. And really, when you read through the book, what Horton told me is some of the greatest tragedies in our response occurred not because donors failed or systems failed, but people failed because of petty differences, personal issues, and animosities. And we need to keep looking at ourselves and each other and think about that. As he put it, we must pay attention to people, observe their imperfections, and protect us all from ourselves. So you might want to someday look at that editorial. And I will finish, and I know I've gone on a little too long, with a paragraph from the book. So the loss of Lange and others on the MH17 flight was a powerful reminder of the remarkable people engaged in global health, many of whom I have been fortunate to work with. Lange and others, in the words of President Obama, were focused on what can be built rather than what can be destroyed. This book has been to explore how different people, institutions, and nations have sought to respond to AIDS and the factors that have supported or hindered these efforts. Often what provided the best support has been the relentless commitment to humanity as exhibited by Lange and others on board that flight. Often what has most hampered these efforts seem petty in the big picture: personal disagreements between individuals, the supremacy of national over international interests, and the desire to retain complete autonomy over one's little piece of institutional pie. So that's the story, and I hope some of you will be interested enough to read parts of this. Thank you.
Okay, Mike, thank you very much. So, although I definitely would like to also discuss on the last bit, what can we do today, basically, I also had a first question myself, Mike, or to tell. Okay, closer again, sorry. So, you ended with it, but we also, I told you one way of, maybe a way of looking at your book, and you're also very explicit about it, is the egos. And I first thought, okay, let's ask how costly was it, but I think that's not the right question. So, that we talk today about complacency, and that also has a lot to do with the thing that we achieved a lot. So, in between everything going wrong, maybe it's too big of a question, but who moved it in the right way?
So if I look back over 36 years, I would pick a few moments. One was the courage that John Mann had to speak out about the pandemic at a time when people were scared and at a time when there was incredible stigma. It's hard to imagine, but even in 1990, we had no idea where this thing was going. And the ability to talk about sex and drugs and homosexuality, I mean, these were things that were hard to do in the beginning. Now we were much more relaxed about it in many societies anyway. So I think that was a critical moment that we were able to talk about it, okay? That was really, really important. We were able to mobilize the world against the pandemic and get people to understand how serious this can be. Of course, the first big moment is when Uganda has the guts to stand up in the World Health Assembly. That's the first big moment. Second big moment is the advocacy from John. And then, of course, the third big moment is when we have the drugs that become available and we can start to save lives. Look, prevention was tough, and there were no great breakthroughs in the 90s. We tried many things. We started vaccine development. We were promised by the U.S. government we'd have a vaccine by 1990. There's a lot of news written about that. You can go read about it. Secretary of Health Heckler promised a vaccine by 1990, okay? The U.S. advocacy, the activists in the U.S. were critical to getting these drugs out. I was very frustrated, as I talk about in the book. I could not get the U.S. activists interested in the global pandemic. They basically blew me off because people were dying in their own country and they couldn't think about the global pandemic. But their advocacy did make drugs available eventually. So that's a big breakthrough. How fast these drugs were developed and how effective they were. That's a great breakthrough. And then we have, after 2000, because I think of the availability that we can really save lives, we get the Global Fund and we get PEPFAR. PEPFAR was driven by the religious community, by the faith-based community that convinced President Bush. That's what that was. That was the faith-based community. That was a tremendous achievement. The Global Fund, there are different views on this. I personally think that Kofi Annan had his own agenda. That's the main reason we got the Global Fund, but there were other reasons as well. So there have been great moments, Mikhail, that have really brought us forward. And look, we have 60% of people on treatment. How many diseases in this world do we have 60% of people on treatment? For hypertension, I promise you there are many more people with hypertension not on treatment than on treatment. So that's a great success. What the fear is now is we may go backwards because of complacency, because of this great push on UHC at the expense of AIDS, if that happens, and because we have now entrenched some big organizations with a lot of staff, spending a lot of money, and the question is, do we need to look at our governance? I think it's really, to me, as I've said in a few sessions here, a very interesting point in the pandemic, where all our successes have brought us to this point, and the fear that we may go back. Now, what could change this overnight is a vaccine that has high efficacy, a cure. That would change. If science got there fast, that would change. But I don't see either of those happening unless there are some surprises I don't know about in the near future. But that's a really important question. We can't forget our successes, but part of the complacency is because of those successes. And young people I talk to today, many of them, they're not concerned. If they get sick, they'll take a drug. They don't think about the fact that's 50 years of treatment. 50 years of treatment. That's a long time to be on a drug. And then we have potential resistance issues and compliance issues. And hopefully that won't be the case, but that is where we are today. So I think your question is, we should not forget our successes, and I mentioned certainly the ones of the global program on AIDS in my presentation. And the people that have moved us to where we are need to be congratulated. But now I think we're at a really interesting point where we have to think how we make the next, what's the new paradigm? How do we move forward and not backwards?
Okay, let's open up. Is there anybody who has a remark or a question? Someone who wants to say something? Please. Sure.
Yes. So you mentioned that we'll not treat ourselves out of this epidemic, right? So treatment is not the solution. So what are the biggest hurdles there, and how can we overcome them?
Well, I think there are people that are very hard to reach. Okay? And it's those that we aren't reaching. And that is why universal health care gives us hope of reaching. Unfortunately, a lot of the people we're not reaching and having difficulty reaching are the key populations who are more vulnerable to HIV infection. And if you look at the KwaZulu-Natal data, many of that 70% are in sex workers. Many of that 70% are young girls who are having sex with men who refused. Only 21% of men in KwaZulu-Natal have been tested. So we're finding that if we had everyone on treatment, which was a dream, we could cut down transmission dramatically. And in fact, as we heard at this conference, there is now a study going on in KwaZulu-Natal where they are passing out antiretrovirals to every home and asking everyone over 15 to take these drugs every day for a year to see if they can break transmission in this area of KwaZulu-Natal. So the issue is being able to deliver these drugs. Maybe UHC can help us in some areas, but if we're going to get UHC, we need to involve these key populations, and we need to involve civil society that can reach these populations. That's been our biggest dilemma. And we need to think, therefore, also of primary prevention. Because we still have 40 million, 36, 37 million people who are infected. 1.5 million people infected this year. So newly. So we need to also come up with better strategies for primary prevention.
So thanks, Mike, for your comments and for your book. I really look forward to reading that after this conference, and it brings back a lot of memories. I mean, I've been part of that story, but we all have our own perceptions, and to see it, from your perspective, but also with the research that is behind that, I think it's incredibly important that we recall this history. I'm glad you mentioned also Kofi Annan, because he then played a very critical role in the creation of the Global Fund in particular. And that is one of these issues, because it became part of the Millennium Development Goal, era. And it had only partly to do with AIDS, but it was fortunate in a sense that in the year 2000 there was this kind of momentum with the MDGs, was a growing global economy, there was money around, and that was an opportunity to create an organization like the Global Fund. Now we are in a different phase in many, many different ways. The AIDS response is at a very different point, and sometimes it feels at this conference as if we move back like 20, 25 years. We have the same discussions here in Amsterdam as we had almost like in 92 in Amsterdam, which is quite amazing. Some of the key questions come back about prevention and how to reach the most vulnerable populations and so on. And indeed, we can't treat ourselves out of the epidemic. But the response has now to be part of the Sustainable Development Goals. It's a different era, and we have to recognize that. And that's why I think, there's no dichotomy between UHC and AIDS. It can only succeed together, if you like. We will not be successful in the global AIDS response unless we position ourselves as being part of the SDG, agenda and the UHC agenda. We have to see that we don't lose what we gained in the kind of AIDS response and in the huge kind of civil society movement that carried this forward. And we have to translate that now into this kind of UHC agenda. But we will not succeed if we push that in isolation. The political support is on the kind of UHC. You see that with many governments. And the trick, I think, the key point will be how we can combine that. And we also have to look at the other diseases so that AIDS doesn't seem to be, the exception out there where we achieve big coverage and so on, and others are neglected. It will not work. Politicians, by the way, also politicians in the countries in the South are not accepting that anymore. So we can only elevate that together, if you like. But the trick will be, how can we bring that together in this new era?
So I think you've said it beautifully, what I was trying to say. I actually spoke in a session just on that yesterday. And someone stood up in the audience and said, of the first 30 countries that reported on how they were doing on UHC in some big forum, not one had invited anyone from an NGO to participate in that exercise. Not one had looked at key populations. So I think the question is whether we can achieve what you're saying and how to achieve it. And what role will your agency, what role will PEPFAR and UNAIDS play in that? And how welcoming will the UHC community be about that? I was in a session on Sunday that Mikel ran, and I don't know if you were there. It was a pre-conference. And you had the head of PEPFAR, you had the head of UNAIDS, you had the head of the Global Fund, and you had the Deputy Director General of WHO. And when you had them up there talking about their priorities, you didn't get a sense they felt they were endorsing what you were saying. And particularly with the, if I may say, PEPFAR, clearly feeling we shouldn't do anything different. We should keep things as they are. So I think the interesting question is whether we can get to where you were, and maybe that's the role that the fund will have to play.
One more question? Somebody theirs? Constance? No. Okay, because we are already quite over time. Can I say, I'm not sure, I have to be careful with my words, but what may be very different from the beginning is that in a way, if you look, because it's all those people and their egos are very important also to move things forward, then at that time, everybody had to gain, basically. And now I'm triggered because we constantly say here, I hear it everywhere, we ask ourselves now the same questions. But something else has fortunately changed. It became an industry. So I think it's maybe the same questions, but it's probably not that everybody will gain. Hopefully, the people living with HIV will gain. And I think sometimes that's much harder choices to be made. So this is more a comment, but maybe you can finally comment.
It's an excellent comment, and I hope we'll feel that way as we move forward. I think those who are leading these agencies now, who are leading the response globally, really have to get together and deal just with your point. And I'm hoping, hearing what you say, that this will happen. I personally believe WHO still has not recovered fully from the shutting down of its program, and needs to be brought in a collaborative way. And UHC is seen, like you say, as part of the solution to AIDS, and not as the alternative to exceptionalism. So, thank you.
Okay, thank you all. One more applause.